Okay, this meeting is being recorded. Very good. Okay, all right, so I'm going to talk about the kidneys. Really just some basic stuff today because I'll have a follow-up later on in regards to some of the more common ailments, maladies of the kidneys and the renal system. Because I mean, there's like a gold mine of different aspects to the kidneys and the bladder, the whole renal system. That's could take several of these PowerPoints. Anyway, let's move through this. Okay, anatomy, structures, what do they look like? So the kidneys are basically one of our primary filtration systems, and so it gets fed by the renal artery, as well as the outward flow through the renal vein. So blood processes through there at incredible rates and I want to say volumes throughout the day. The renal artery, though, supplies oxygen, nutrients, and needed blood to keep the kidneys going, to be honest with you. And the renal vein carries away filtered blood that needs to be recovered and used by our system, our body system, and away from the kidney. And the basic structure itself are these two bean-shaped organs, one on the right, one on the left. And of course, they have the blood supply, both venous and arterial. And then you have the ureters, which once the urine is formed, it travels down through the ureters, and from there it collects in the bladder. That's the old collection system. And there are a couple of different mechanisms that one can tell when you need to actually go, when you need to actually expel the urine. And that's done by the nervous system to the brain and back again. And so there are all kinds of muscles and sphincters involved when it comes to the bladder and the urethra, which leads outside to the outside of the body. So this is kind of the basics. You don't really need to pay attention much to the renal pelvis, cortex, medulla. That's for kind of a deeper understanding of kidneys and kind of beyond this. But I kept that illustration in here because it shows the inner workings or the inner details of the kidneys, just in an exploded version. So, all right, let me make this happen. Here's a short video. Okay. Off it goes. Oh, you know what? It's already there. All right. Okay, if I go to browse YouTube, it should show. Okay. No, that's not what. Tim, what happened to my video?
You can also go on top of the tab.
Oh, right here?
That one right there.
Oh, God, there it is. I see it. Okay, a little technical difficulty here with me trying to figure out where things are. Okay, so this is a real brief. Let's see, I hope all things are turned up and you can hear.
It should be turned up.
Okay, all right. So let's go. How do the kidneys work?
It's a hot day, and you've just downed several glasses of water, one after the other. Behind the sudden urge that follows are two bean-shaped organs that work as fine-tuned internal sensors. they balance the amount of fluid in your body, detect waste in your blood, and know when to release the vitamins, minerals, and hormones you need to stay alive. Say hello to your kidneys. The main role of these organs is to dispose of waste products and to turn them into urine. The body's 8 liters of blood pass through the kidneys between 20 and 25 times each day, meaning that together, these organs filter about 180 liters every 24 hours. The ingredients in your blood are constantly changing as you ingest food and drink, which explains why the kidneys need to be on permanent duty. Blood enters each kidney through arteries that branch and branch until they form tiny vessels that entwine with special internal modules called nephrons. In each kidney, 1 million of these nephrons form a powerful array of filters and sensors that carefully sift through the blood. This is where we see just how refined and accurate this internal sensing system is. To filter the blood, each nephron uses 2 powerful pieces of equipment, a blob-like structure called a glomerulus, and a long stringy straw-like tubule. The glomerulus works like a sieve, allowing only certain ingredients, such as vitamins and minerals, to pass into the tubule. Then, this vessel's job is to detect whether any of those ingredients are needed in the body. If so, they're reabsorbed in amounts that the body needs so they can circulate in the blood again. But the blood doesn't only carry useful ingredients. It contains waste products too, and the nephrons have to figure out what to do with them. The tubules sense compounds the body doesn't need, like urea, left over from the breakdown of proteins, and redirects them as urine out of the kidneys and through 2 long sewers called ureters. These tubes empty their contents into the bladder to be discharged, ridding your body of that waste once and for all. There's water in that urine too. If the kidney detects too much of it in your blood, for instance, when you've chugged several glasses at once, it sends the extra liquid to the bladder to be removed. On the other hand, low water levels in the blood prompt the kidney to release some back into the bloodstream, meaning that less water makes it into the urine. This is why urine appears yellower when you're less hydrated. By controlling water, your kidneys stabilize the body's fluid levels. But this fine balancing act isn't the kidney's only skill. These organs have the power to activate vitamin D to secrete a hormone called renin that raises blood pressure, and another hormone called erythropoietin, which increases red blood cell production. Without the kidneys, our bodily fluids would spiral out of control. Every time we ate, our blood would receive another load of unsifted ingredients. Soon, the buildup of waste would overload our systems and we'd expire. So each kidney not only keeps things running smoothly, it also keeps us alive. Lucky then that we have 2 of these magical beans.
How do I leave this now? Yeah, yeah. Oh, how do I leave this, Tim? Do I,
escape.
oh, escape.
And then
Good Lord.
you can click back on that.
Okay, all right, there we go. All right. So that was a nice brief video that didn't chew up a lot of time to give you kind of the basics of the workings of the kidneys and why they're so important. Well, just to reiterate some of these things, you know, what the kidneys are responsible for. They're responsible for regulating concentrations of water and salts in the body. They also help maintain the body's very narrow acid-base balance that keeps us in homeostasis. If you get too acidic, that would be below 7.36 or 3.5. That's not healthy. Or if you get above 7.43, 4.4, then it's too alkaline. That also leads to problems as well. So the kidneys help to maintain that delicate balance. So with each beat of the heart, and reiterating how much blood circulates again and again and again throughout the day. It's a workhorse of the body, really, when you think about it, just like the heart is when it comes to pumping blood constantly. We don't think about it. Kidneys are filtering that blood constantly with absolutely no thought from us. And of course, the glomerulus, which she mentioned in the video, is the kind of the functional unit of the kidney, and it controls the rate of filtration. There are healthy rates of filtration and unhealthy or unhealthy rates. Healthy and unhealthy. Usually a filtration rate greater than 60 is considered a healthy rate of filtration, of removal of products of metabolism, etc. If it lies under that and becomes steadily lower, that tends to be an unhealthy rate of filtration, where what needs to be processed and then outed from the body is not happening at a normal rate to maintain homeostasis and health. So here's some functions again, regulating your ions within the blood. That would be certain elements like potassium and sodium, etc. Blood volume, of course, maintaining a certain volume in the bloodstream and eliminating urine in the process. Regulating pH, production of certain hormones like calcitonin and erythropoietin. She mentioned in the video erythropoietin, and that's a very important hormone because out of that comes the production of more red blood cells within the body. And so typically individuals who have had quite a bit of damage to the kidneys aren't making erythropoietin. So we used to give erythropoietin, or the other form of it that we give in the hospital called Epogen. We used to give that subcutaneous. Now it can be given during dialysis in the intravenous form, but is necessary for the continued production of red blood cells. And of course, the excretion of waste products, and of course, drugs. Anything you ingest has a very good chance of being processed through the kidneys first. It's not the only filtration system in the body. The liver is also another filtration organ within the body as well. Okay, with me still? Everybody out there in Zoom land? Any questions thus far? Okay, I'll keep going. Again, this goes back into some of the inner workings of the kidney, and talking more in this sense here about the nephrons and what they do within the kidney and why they're so important as functional units, because we start out with, so many nephrons when we're young and into young adulthood. And as we get into older adulthood and old age, the number of nephrons is reduced, either by, normal processes of aging or by disease. Doesn't always mean that your kidney isn't doing its job. It just means that the number of functional units called nephrons are fewer and fewer as we get older. Again, this slide is reiterating that process. So I'm going to move on. And of course, proper kidney function is dependent on good flow. Proper kidney function within the body depends on adequate flow of blood. And I want to say also of, water content or fluid content within the blood. And as the video presented, blood vessels in and blood vessels out go all the way down to the level of capillaries, where a lot of exchange, retention, exchange, excretion takes place in that little pocket called the glomerulus within the nephron. And so, which leads me to the next. I won't talk about it much here, but in the follow-up to this, we'll talk a little bit about what happens when there's destruction of not just the blood vessel system, but the shutdown of certain areas of the kidney and the effect it has on the entire body as a result. So we'll get into some of the diseases with the next installment later in the month. So again, the process of entering the glomerulus and the collection of substances that are reprocessed and those that are not, that are actually become waste products or excess urine, even vitamins, in many cases, vitamins, which she mentioned in the video. If there's excess vitamins, usually they're processed out of the kidneys into the urine and out of your system completely. And I'll get into this in the later slides about why we look at certain things when we're prescribed medications as older adults, and why those medications have to be altered as far as doses and timing in order to stave off the possibility of toxicity within the system. So we'll talk about that in the coming slides here. So basic functions. And I like this slide, and the information I got actually, I didn't get it from these two references. Primarily the references I used were my old, this is the old Pathophysiology Made Easy that's like 24 years old. When I was going from LVN to RN, I utilized this a lot. And then just from a few years ago, for one of my continuing education necessary units, I read through this, gerontological nursing and healthy aging. So I actually retrieved some information from this source as well. So again, controlling acid-base balance, water balance within, the extracellular fluid in the blood, or what's in the cell itself, the intracellular fluid. Maintaining a proper electrolyte balance, so sodium doesn't get too high or low, potassium doesn't get too high or low, because there are consequences if these build up, or if they are also, on the other hand, too low. Removing toxins and waste products from the body from metabolism, very important. Maintaining proper blood pressure. And that by the process of the hormones that are secreted, as well as the amount of fluid within the system as well. Too much fluid will raise blood pressure. Too little fluid, which we'll call dehydration, will typically lower blood pressure, sometimes into dangerous levels. And that production of that particular hormone, erythropoietin, and how it affects the centers where red blood cells are produced, like bone marrow, for instance. And of course, activation of vitamin D, which goes along with that production of erythropoietin. This is just a quick, ready reference of 7 basic things, 7 basic, I want to say functions, that's it. Not things, functions of the kidneys. And so the kidneys are usually located right near the base of where if you think about your ribs, And right near the 11th or 12th ribs in the back, that's where your kidneys tend to be. Okay, and so that would be in the higher lumbar region of your spine and lower thoracic region. So, and they tend to lie behind, I want to say viscera, like your organs, I want to say intestines. So they lie posterior to that. That's where you'll find your kidneys. And they basically lie in that particular way in everybody. So I like this one slide because, you know, in general, it's not a picture. This is from a diagram that was made probably as a teaching piece for patients, as well as probably nursing students. You know, what the kidney looks like. And here's some amazing facts, which the video actually went over, that the kidney has over 1 million functional units called nephrons. It's, to me, that's amazing, over 1 million. And each one of these nephrons contains that glomerular pocket, and then a tubule that comes out of that glomerulus. And in that glomerulus is where filtration of the blood takes place. And so the beauty is the kidney can filter out as well as retain certain elements within the blood, being very small to a little bit larger. And thinking that urine is the result, is usually around 95% water. So no matter what color the urine is, it's usually around 95% water. And again, the video presented, and I like the way she did it, is that, you know, when there's less water, the urine tends to have a different color to it. If there's more water, it tends to be a much more diluted yellow, almost like a straw color. You know what straw looks like, the color of it, versus if urine comes out really concentrated, it almost can come out looking like Tang or tea, for that matter, when it's really, really concentrated and has a lot of solutes into it, dissolved into it.
Does that mean that clear is good?
Yes, usually it does. The clearer the urine, the better. And it's wonderful that the kidney can detect whether or not you need to retain water or you need to really get rid of excess water. And that's the beauty of it. When you're dehydrated, the kidney is going to make as much effort as possible to retain water and not let the body excrete that. Whereas if you got way too much water in your system, the kidneys will sense this, and they'll open up the passageways in order to, I want to say, make more urine, really, and in larger volumes. And what that tends to do is, well, it tends to dilute whatever other solutes are in urine, like, you know, waste products of metabolism, proteins, other substances, you know, electrolytes, whatever else is in the blood, whatever else is in that constitutes waste products. So it's a beautiful organ, and luckily we have two. And another thing about that is if you lose one of them, you can still operate quite well on one kidney. And so not so maybe with other systems. You can, if you lose a part or a whole of one of your lungs, still function with one lung. That's possible. It just means that, you know, if you get to a point where you lose a kidney, then you have to be very careful about, you know, what you take in so that you keep that remaining kidney healthy. So it's amazing that way.
It's funny how I used to work build stuff in the military. They build in redundancy, sometimes triple redundancy. We have 2 kidneys, 2 lungs, but only have 1 heart and 1 bladder and 1 brain.
Yes,
Think about how the duplicates that.
right, right. And what's amazing too, and boy, this is for a whole different discussion, is how the circulatory system has a way of finding its way past an area that's either dead or hurt in order to keep that organ going or processing. Like you mentioned, the brain, you only have 1 brain, but you have 2 sides.
That's true.
So with the heart, it becomes trickier and trickier, and maybe that analogy isn't so useful. One part of the heart dies, and well, yes, circulation can be bypassed with collateral, but that part of the heart no longer functions well, and that affects the way the entire rest of that organ works. So you're right, the redundancy thing is important, though. It truly is. So again, it's an amazing organ system. So if you look at, the composition of your urine, I mean, there's so many things that make up, what you avoid each day. And what are some of the products when you think about it? There's all kinds of, oh, for heaven's sake, elements, ions like potassium, sodium, chloride. There's the urea that she mentioned in the video, a waste product from, usually it's from breaking down proteins in digestion, and also with, I want to say, muscle, what do you call it? How your muscles are constantly repairing and then rebuilding, repairing and rebuilding. A lot of those proteins go out in the way of urine and create urea. So it's again, how it's able to do this is still, to me, a huge mystery and a bit of a miracle, to be honest. But on the other hand, when they do your urinalysis, and I know one time in the future, I'm going to do lab values as they are associated with urinalysis and microscopy of urine and what they mean. Because boy, you could go into this and create an entire PowerPoint and discussion out of what does it mean when the doctor does and orders a urinalysis. What do these things mean that they're looking for and they find? So it's pretty amazing. It's pretty amazing. Again, looking at your urine as a nurse, it's kind of like, well, geez, I look at everything that comes out, and looking at these things as a nurse, you're kind of like, wow, urine's really concentrated, or, oh, they're not making enough urine here, there's a problem, or wow, they are really putting out a lot of urine, what's going on? What does it look like? Is it bloody? Is it concentrated? Is it straw color? Is it somewhere in between? And oh my goodness, so again, that's opening up another can of worms for another time. So a couple of quick things about some of the hormones synthesized and used that have an effect on your kidneys. One of those is antidiuretic hormone. And it has an effect on the kidneys where that hormone, if in the bloodstream, antidiuretic hormone is too low, tubules will become a little less permeable, and urine output would, I want to say, increase that way. So in other words, there's not as much of an uptake of fluid, and during the processing, if there's antidiuretic hormone being low, you're going to get an increase in urine output, and the concentration of what comes out simply in the urine is lower. But if there's a high rather than a low, the permeability of water increases in the other direction, causing urine output to actually decrease and become more concentrated. In other words, the urine becomes a little darker color because there's more of the solutes. Yeah, more solutes than solvents in the urine output. And this has an effect on your blood pressure, as well as, because either you're retaining water or you're getting rid of too much water, and that has a direct effect on blood pressure. Too much water, retention, higher blood pressure. Too much water going out, dehydration is occurring, and there's your blood pressure decreases because of that. And so this little bottle here on the right-hand side I like, so I put it in here because it gives you an indication of what's going on, you know, according to the color of your urine, simply put. And so it's interesting. Again, as nurses, we tend to look at this closely when we are collecting samples and specimens and making guesses, and then we have to, you know, properly put them in ice and send them to the lab to be evaluated, et cetera. And then we can see from the final results, what did they find? What did they find? You know, so it's interesting stuff. Now, there's another hormone, or there is, yes, another hormone called aldosterone. It also has a way of controlling water retention as well as sodium. And water tends to go usually where sodium or salt goes, okay? So the higher the concentration of one means a higher concentration of the other. So retention of sodium and H2O kind of go together that way. If there's a lower concentration in the bloodstream of aldosterone, it promotes sodium and water excretion via the tubules. So this is another mechanism of control on fluid and certain electrolytes in the system. It also has an impact on potassium levels as well. Whether it be a secretion of more potassium or retention of more potassium. And these electrolytes are important simply because if you get rid of too much sodium, there is a chance that that's going to have a detrimental effect on you in the long run, just as too much sodium means you're collecting too much fluid. Same thing with potassium, because there's a delicate balance of these electrolytes within the system. Too much is not a good thing. Too little is also not such a good thing. So they play a major role, and they affect the kidneys and what the kidneys are able to do. So, you know, specifics on control of blood pressure by way of activating certain kidney enzymes like angiotensin, or actually renin, which has an impact on angiotensin enzyme 1 and enzyme 2. When that system is activated, it has the impact of increasing blood pressure in a real system that's, I want to say, not pathological, not pathophysiological in nature, but if there is a loss of blood pressure, a loss of fluids, serum within the bloodstream, that system goes into effect to help boost blood pressure rather than lower it due to loss of fluid or blood. But it also has an effect of raising blood pressure by vasoconstriction. And that's the normal action of what this activation system does, is it helps to boost blood pressure. And it helps also boost increases in absorption of sodium and water. It's when those systems get out of control, and what happens is that certain measures have to be taken in the way of these angiotensin receptor blockers, so that vasoconstriction, when there's a pathological reason for this system to be activated and working, it will inhibit that vasoconstriction and keep blood pressure in the lower to normal range, which is good. And this is why you have these angiotensin converting enzyme blockers, and they will move to help lower blood pressure or to stabilize blood pressure. Again, God, you could have a whole nother discussion about the medications that affect the kidneys. This is just a real brief, and I mean real brief. You could have a much larger discussion on this.
Could you prepare something that shows the correlation between blood pressure medicines and heart medicines and kidney issues?
Yeah,
That would really be helpful.
I could, yes. And that's an important discussion to have, because the conditions that present themselves within your whole blood, your whole vascular and renal system, and why these drugs, like these angiotensin converting enzyme blockers, have to be used, why they're needed and why they're useful. Yeah, I could do that, certainly.
That would be appreciated, Rob. Thank you.
Sure, absolutely. I mean, there's this is just angiotensin blockers. There's another one. These are actually the drug classification I'm talking about when I'm talking about this. They're called ACE inhibitors. That's what they're called, ACE inhibitors. And they work on this system that goes into place in the kidney system or the renal system. I don't know why I didn't say ACE inhibitors. Just a little bit of a block on my part. Now, this is important, and I only touch upon this. I don't go into great detail, but changes in the kidney system, like other areas within the body, as we age decade to decade to decade, and specifically as they work on the kidneys, the filtration rate is key. The glomerular filtration rate. Some of you may have seen this on test results, but it is a key finding. And it is an indication of your kidney's ability to filter products. So that's why I put a key number is to have it greater than 60, preferably somewhere between 60 and 100. 60, 90, 60 and 100. If you get something that's borderline or below, then, well, in the 50s. You know, if there's something that's, I want to say, out of range in either direction, it may be an indication of something else going on that's affecting your kidneys. And so it's an important finding, especially as we consider how the kidneys change as we age. For one thing, blood flow to the kidneys changes. It diminishes as we age. It decreases. And this has a direct impact on your filtration rate as well. And also, because all fluids and blood generally filter through the kidneys, with a reduction or an abnormal filtration rate, your body or your kidneys have a tougher time regulating fluid and electrolyte balance, if that makes sense. If the filtration rate is altered in any way, fluid and electrolyte balance is going to be altered as well. And that could have a direct effect on you, either in retaining fluid or having not enough fluid within your system. And that also includes other filtrates, creatinine, blood urea nitrogen, electrolytes, waste products like urea. It has a direct impact on all of that. And even with a normal kidney, you're going to see some of these things happen anyway. Even if you have a good kidney, it's not diseased, etc., you're going to see reduction in how the kidney operates over time. In fact, no, I think every 10 years, you're going to see roughly changes in things like urine output, for instance. So blood flow to the kidneys and other structures within that kidney system has a decrease of about 10% per decade. So when you're younger, you are able to process 1,200 cc's per minute in a younger adult, maybe. But as we age and we get up to 70s and 80s, that reduction or that production or I want to say filtration and use is cut in half to about 600 per minute. So those are obvious changes. The kidney also shrinks. The processes and the number of glomeruli and nephrons also diminishes. There are changes in the tubular system, vascular changes within, the kidney itself. So, what this all leads to is ARI, which is acute kidney or acute renal insufficiency or acute kidney insufficiency. We can lose as much as 50%. And this is a number I thought that's at least helpful in knowing. You could lose 50% of the capacity of your kidneys under even normal circumstances and yet experience little change in your body's homeostasis. Because other changes are also happening too. What you need as far as water and food and other things throughout, your body's ability to process, remain in a homeostatic state. It changes throughout age. And so even if you lose half of that filtration capacity, it might not change how homeostasis, how you feel within, I want to say different areas of the body as far as organ systems. Because when you think about it, the kidneys are going to have an impact on everything within the body, everything. It just really what it comes down to is as we age, we're more susceptible to disease and illness. And we're susceptible to fluctuations in fluid and electrolyte imbalance. Sometimes there's structural damage. Sometimes medications are problematic because the kidney is unable to filter as, what's the word I'm looking for, as efficiently as an organ system. Other things your kidneys are more sensitive to, like contrast dyes used during certain diagnostic tests. And this is why you get a lot of warnings about use of contrast within the system, because the kidney has to process that. Okay, and eventually it can have a toxic effect on your kidneys. And this is why certain contrast dyes, certain dyes that they use for these tests, you know, are eliminated, and a different type of test is needed for someone who's elderly or older in age, because they can't, because of the toxicity of certain dyes they put into the body. An elderly or an older age individual just doesn't have that same capacity to filter out and recover from, so they don't use them. Yeah.
Disease process, do they consider maintenance?
Okay. They have different stages of kidney injury or renal function. It goes through stages like stage 1, 2, and even up to stage 3. As the disease progresses, you might still be able to make urine. You might still be able to make urine, which means that your kidneys still retain some capacity to create urine and to move waste products from the blood system out of the body. It's when you get into stage 3, 4, and 5 that your kidneys no longer are able to do such. They're unable to function in a normal capacity anymore. In other words, they don't work. And that's when dialysis comes into play. And then, you know, of course, what's the next step? As you mentioned, there's a possibility of a kidney transplant on someone who's, you know, maybe a right candidate. One kidney or more than one kidney are not functioning anymore. So when it gets severe, that's when the thought of a kidney transplant becomes a reality, and when it should be explored seriously, because dialysis is good. I'm glad we have that, but boy, if you miss dialysis, you could be in big trouble, even if you miss one dialysis appointment. And wherever you go, whatever you're doing across the country or out of the country, you have to be close to a dialysis chair in clinic. If you're not, you're in big trouble. You're in big trouble. So even in a normal kidney, as we age, there's so many reduced capacities, and I guess it's that way with everything. Kidneys shrink, our ability to handle salt and other electrolytes diminishes, how our system handles excess water just doesn't function properly anymore. Even how, you know, our body handles something even like a fever, and how that relates maybe to not just drugs, but water and other restrictions put on the kidney when there's an infection. And it could be a kidney infection, a bladder infection. It could be it could be a lot of different infections, different sources. That could have a direct effect also on your kidney. And by fever, I do mean infection, whether it's viral or bacterial. So I included this slide because what happens with increase and decrease of, you know, functioning in the kidney, you know, what happens when certain things are decreased and certain things are increased. And when a kidney gets diseased or becomes progressively less functional as an organ. This is very important. I saved this for the last because this dictates for, you don't even have to be older for creatinine clearance to be an important aspect. and why we look at creatinine clearance in the bloodstream. Because this is how pharmacy, the doctors and pharmacies, and even the nurses are part of the process of why dosages of certain medications, drugs, antibiotics are either lessened, not lessened, they're reduced and not given so often, because if the creatinine clearance is not within normal limits, it means your body's ability to process those drugs takes longer, and the longer it takes, the more the toxicities from those drugs can be cleared from your kidney and bloodstream. And that will have an effect on you as an individual. But if something becomes toxic and builds up, that will put you at greater risk for a bad outcome, death, toxicity of any drug. And so I put this was a nice slide I got off the internet of normal results for male and female, what it looks like when they draw blood for this. And there are differences in, I want to say, what's normal and what's abnormal in both the male and female system. And it doesn't have to do with the fact that, in both men and women, we have two kidneys. It may have to do with, I just lost that thought. It may have to do with blood volume, and men and women are slightly different. And that's true. Blood volume and fluid volume, etc. And that has to do with things like body composition. So it doesn't have to do with the fact that, the kidney in the women are bigger than a kidney. No, they're usually about the same size and they're in the same place. It just there are other factors involved in that. But this is why it's important when it comes to drugs, medications. There's a greater chance for them to become toxic in older individuals. And so drug doses have to be reduced. They have to be reduced. In most cases, that's what we see. And that's what we end up, with. In order to keep, yes.
No, I thought you were done. Go ahead.
Oh.
I have kidney issues, and the tests that they test me for are creatinine and calculated glomerular filtration rate.
Yes.
And also urine protein to creatinine ratio, but nowhere does it say creatinine clearance. Is that a test I should request, or?
No, I mean, protein in the urine is an abnormal finding. That could be from a number of different reasons. It could be due to lactic acidosis. It could be due to, I want to say, an improper, the kidneys just aren't separating or balancing and retaining protein. Instead, it's being loosed out into the urine, which is considered an abnormal finding. And same with creatinine. Typically, you'll see creatinine as a BUN, which is a blood urea nitrogen and creatinine ratio, or you'll see it as a protein and creatinine ratio, or you'll see it as a simply creatinine clearance measurement. And it depends on what your physician is actually looking for. When he orders these tests to be run, it doesn't surprise me that the glomerular filtration rate is a lab your physician is asking for, because he wants to know how efficient is your how efficient is your renal system in processing, creating urine, making urine? Because that's an important factor to whether you're, retaining fluid or whether you're retaining some of these byproducts of metabolism or waste products as well. That's the biggest deal when it comes to these creatinine, protein, and filtration rates is whether or not your system is processing waste products properly, the renal system, and is your renal system eliminating fluids and wastes the way they should under normal circumstances. If you're dealing with a chronic kidney issue, it's important your doctor stays on top of that on a regular basis to make sure that he can pick up on any changes before your kidneys get worse. And that's the last thing you or your physician wants to happen.
But if
So,
I take medicine both for kidney and for heart and blood pressure and so on, I think all of us take a bunch of different things. Would this creatinine clearance show whether or not any of, because some of the pills seem to be contradicted, some they work against the other pills, and so would this show that, this test show that?
well, gosh, it's the things that would be a good question for your physician. And the reason I say that is because there are some medications that have a greater impact on your kidneys creatinine clearance. I want to say ability to filter out and rid itself of creatinine, which is a byproduct, a waste product of this metabolism. It would depend on the impact it has. If the drug has a greater impact on your kidneys, he would probably be more worried about the creatinine clearance. In other words, he may not want this blood pressure medicine to build up in your system and I want to say become toxic either in too much of this drug building up in your system, rather than, this drug has less of an impact. I may be a little less worried about creatinine clearance, but he may have, according to the literature, et cetera, and what we know about certain drugs, we know that creatinine needs to be paid attention to when prescribed certain medications. And so they may have you on a regular blood draw in order to look at that renal function panel. And that leads me to, talking about, not just what you find in the urine in the way of products, because the urine, we're looking for certain things, but in the bloodstream, we're looking for certain, products too that relate to kidney function. And that's why then the doctor may ask for a renal function panel in order to see how your kidneys are doing with what's in the bloodstream. What are some of the products, and are those levels high or low within your bloodstream? Because you can look at this both in terms of the urine as well as the blood. There are two ways of finding some of these things out. And so, yeah, if you're taking multiple drugs, and I want to say multiple medications, there might be a concern as we get older for how are your kidneys processing so many medications at once, or maybe not right at the same time, but throughout the day. Are my kidneys functioning well? Do you have some other problem that might inhibit kidney function, like multiple kidney stones? I want to say maybe you have benign cysts or calcifications that show up on certain tests. Other things like that that affect structurally what's going on within the kidney will have an impact on how your kidney functions. So, there are other reasons too where that might be an issue. So it's good you're asking these questions, in other words.
Thank you.
Yeah, oh, absolutely. And yes, this gives me good indication, your input on what I need to cover, what I should cover, what you're interested in for a future presentation. So yes, I will do those things that you suggested.
Rob,
Yes,
a friend had, that filtration number that you were talking about, that the normal is maybe 60, 65, and hers was 55. And her understanding was she was right at the point of needing dialysis.
yes. That means the kidneys are not filtering as well as they should for whatever reason. You see, sometimes these numbers are temporary. And boy, this is a can of worms, I know. If a kidney is permanently damaged, that glomerular filtration rate is probably going to be permanently impaired. However, if there's an infection, if there's problems with stones, if there is a problem due to medications you've been on that are affecting the kidneys, it might in fact be temporary. Once those other issues have been corrected or have been seen to by a physician or other interventions. Now, if it's a permanently low number, then dialysis becomes a distinct possibility because your kidneys simply aren't functioning as they should.
Well, hers is back up in the 60s now.
Oh, good.
And the only thing that she knows she's done is really watch the sodium intake. But
Yes.
it could be they could have adjusted her other medications, or she was also on Naberstam or something, I think, for pain.
Oh, naproxen.
Maybe that was it. And so maybe that was part of it too. Maybe she was taking too much too long or something.
That's a possibility as well. We don't think about it because many of these drugs that affect the kidneys are over the counter,
Mhm.
and taken in high doses or maybe even for a very long time, it probably will have some impact on your kidney function. And so, yeah, it's oftentimes not thought about. And, when a physician says, oh, just take ibuprofen, just take naproxen, they won't tell you or emphasize, if you take this for a long period of time, there could be consequences or risks to your kidneys. That's some of the things they leave out of the equation, unless you as an individual go and do some research on your own and you look up the drug yourself and you look at some of the greater risks over time, and they're in bold usually. And you look at that and I thought, well, you think, why in the world didn't the physician tell me this when he says, oh, just take naproxen. That should do it. You don't need anything stronger. No. But if you take it long enough, it can destroy your kidneys. Yes.
Mhm. Thank you.
Yeah, you're most welcome. Okay, I think if no other questions, part 2 is going to be at the end of the month. I'm going to include some common kidney dysfunctions. Oh, I think I spelled that wrong.
I have a question.
Nobody knows.
My internal dictionary was not working. But I'm going to include some common kidney maladies and disease processes. It certainly won't be all encompassing because there are so many. And there's, so many too that affect us as we get older that, some of it we simply, it comes with getting older, even if we're healthy in so many different ways, organs fail after a while. They become something, yes, like Kevin says, something's going to get us. And, in many cases, there's no stopping the reduction in the number of nephrons. There's no stopping the reduction in size of the kidneys. There's no stopping changes in blood to the kidneys as well. You may lead a perfectly healthy life, and yet these things are going to happen. And so, yeah, I know. It scares me to think about it too, that as we age, we're breaking down, maybe in steps, some maybe not in steps, maybe in leaps, but it's an eventuality. It's part of thinking about one's own mortality, to be honest. So that's what's coming up, end of the month.
I have a question.
Yeah.
Is there something that would be a kidney friendly diet? If you talk about salt is not.
Well, there are substitutes for salt, and generally speaking, when we talk about diet, what they usually will put you on is a diet that has fewer electrolytes in it, like high potassium, high sodium, and a diet that's, I want to say, maybe with different protein contents as well. And of course, they may also adjust your diet for different fluids, either probably restrict, in some cases, fluids, because if your kidneys aren't functioning well, those fluids are not going to go out of your system in the normal sort of fashion. They're going to be retained because the filtration system isn't working properly.
Okay.
And so they may say, don't take in more than X and such, which means you as an individual, you have to look at food labels, maybe. You have to look at and keep track of how much in the way of fluids you're taking in per day. And so, gosh, it becomes a burden on you, but it becomes a necessary burden. And it puts less, I want to say, it puts less in the end of a burden on your kidneys and your renal system. So this is where responsibility of the individual comes into play. And yes, there are special diets. Right offhand, I can tell you that there are diets in the hospital that we tailor to somebody with kidney insufficiency as well as kidney failure, different levels of kidney failure. And they are very specific. And God, I wish I had a dietary or a dietitian up here to talk. Maybe that's something that Debbie Lucas is an expert on this. Maybe I can tap into her when she comes in next and ask her if she could do something about food and fluid intake, as far as what are some good things, what are some specific diets or foods, or kidney healthy diet. Yes, thank you, Kevin. Kidney healthy diet. So yes, I'm going to tap into her about that. I think it's a very good question.
Okay, good. Thanks.
Yes, absolutely. And I know I've gone over time, folks, and I apologize. But boy, I'll tell you, this thing in the end, final word, the kidney and renal system there's so many aspects to it and so many different areas that could be covered in a presentation. They're so numerous. And so, gosh, in the future, I'm going to talk about the drugs that directly affect the kidney. That is another thing I'll take into the month of February. So with that, I'm going to end this presentation. If there are no more.
Thank you, Rob.
Yeah, you're most welcome. And it's good to see you all on Zoom. And also glad the people who stayed after exercise, thank you for being here as well.